Welcome, everyone. We're excited to have you join Registrar Corp for Retail Therapy, managing MoCRA compliance with beauty retailers. With FDA enforcement in effect, many companies are still unsure of how to handle new requirements. We look forward to guiding you through these requirements today and providing tips for compliance with beauty retailers. I'm pleased to introduce our resident cosmetic expert, Jaclyn Bellomo, Senior Director of Cosmetic Science and Regulatory Affairs, who will share key MoCRA provisions that you must follow and how they impact your business operations. A seasoned, respected key figure in the cosmetic industry, Jaclyn will guide you through how to achieve MoCRA compliance with beauty retailers. Throughout this webinar, feel free to write any questions in the Q&A box, as we've saved time at the end to answer them. Without any further ado, Jaclyn, take it away.
Thank you so much, Alexis, and welcome everyone. I am very excited about today's discussion. It's a little different than what we normally do. We talk heavy FDA, heavy MoCRA compliance, and a lot of what we've been seeing and a lot of what we've been hearing is beauty retailers are setting the standards very fast for companies to be compliant with MoCRA. So we wanted to make sure we touched on this very hot topic, very trending topic, especially as we move into the holiday season. And there's tons of holiday kits and resets and everything you can imagine going into your beauty retailers for the holiday season. So today we're going to talk about understanding the beauty retailer's role in MoCRA, an overview of large retailers' expectations of brands compliance, and I sprinkled in some things that are not MoCRA because I've been launching beauty brands in retailers for all of my career. So I'm going to give you a lot of little tips and tricks. What documentation should be in place to comply? One of the biggest fallbacks I see is not being ready to upload everything you need to upload in those portals. And then again, how to handle the new label and adverse event requirements that are due at the end of the year. This is huge. We're getting a ton of questions about, products on shelf, what to do January 1st, 2025. So going to go through that. And then, of course, challenges with recalls, adverse events, and facility suspensions and inspections, right? So this is very, very important when you're working with beauty retailers, having recall plans, understanding your facility's current status with FDA. So we're going to walk through that. And of course, our interactive Q&A. I did try to leave time for a lot of questions because I feel that this is going to be one filled with questions. So feel free to drop that into the Q&A box. At the end, we're going to have a survey. Please take the survey. We're going to ask you a ton of questions of what you want to see next, if this is the type of content that you like. And of course, if you need us to help you with any piece of MoCRA compliance or any piece of cosmetic compliance that we can help you with. So let's kick it off. Registrar, hopefully you all know we are the world's largest FDA compliance company. We are global experts in MoCRA compliance. We serve over 1,000 cosmetic companies. We've completed over 26,000 product listings in the past 3 months, and we are the only company that meets the ISO 27001 standard for data security to protect trade secrets. So really important that we know our industry, we know our cosmetic brands, and we know what's important, and we've been helping everyone before MoCRA even went into effect. So first one up, we're going to understand beauty retailers' role in MoCRA. And those who have joined us before, you understand that I've always went through like who's responsible for what, right? So you'll have your facility responsible for registration, GMPs, inspections, record access, adverse event record keeping, and U.S. agent for non-facilities. Responsible person, product listings, adverse event record keeping, serious adverse event reporting, safety substantiation, record access, recalls, labeling updates, and of course, fragrance allergen disclosures. Beauty retailers are not subject to MoCRA responsibilities, but are holding brands accountable for compliance. We have seen dozens of letters go out from retailers, alerting brands of MoCRA, alerting brands of their compliance and their need to comply with MoCRA. Many of you that already sell in retailers or have space in retailers, you already understand the complexity that goes into uploading MSDSs, CFA, safety information, labels, even, annual testing documentation, annual audits. Like, this is just normal behavior of working at a huge retailer. But now, we're seeing, even the big retailers, the Walmarts, Sephora's, the Ultas, we're seeing even smaller retailers taking on understanding FDA compliance, right? Because there's a huge responsibility on the retailer to make sure the products that are being sold in their stores or on their online marketplaces are compliant. So again, although they're not subject to MoCRA, they do not want to deal with the negative repercussions of a non-compliant product. It's kind of crazy with all of the social media and all of the beauty publications we see now. I mean, I remember 5 years ago when there was a product recall. I mean, you heard about it like 6 months later, but now you hear about a day of, right? And they'll always tell you where it's sold. And I think that's the really important piece to take away from here, right? So it's eyebrow cream sold at Ulta, recalled for X, Y, and Z, right? So those pieces now are coming together. It's no longer just the brand's name out there, it's also the retailer, right? Because they want you to be aware of where the issue could have been purchased. Much like you see in the food space more recently as well, strawberries bought at Trader Joe's and Costco. Beauty retailers are following similar suit. Publications are as well, because they want you to be aware if there's a problem with the product, where it came from. So if you purchase from that store, you're able to look that up, right? So educating the consumers of the brand, the product, and the retailer. So that negative press that can go out there is not what any beauty retailer wants to have. That's not the type of press they want to see. So they are making sure they're doing their due diligence and holding the brands accountable for this information. Several large retailers have already sent letters, as I mentioned, also requiring brands to have evidence of MoCRA compliance. So this can even include product listing numbers, SPL PDFs, screenshots of the submissions into Cosmetic Direct, additionally, even adverse event contact information. One of the biggest, I think, dreads that we have working in beauty retail is if we ever had a problem with a product, right, and how to get that product back, right? What are the steps to take to get that product back, especially if it's causing an adverse event in the public, right? So having recall plans in place, understanding how adverse events can be streamlined to the brand versus to the retailer. Many of the retailers, as I just mentioned, already have policies in place for existing FDA regulations. Walmart's a huge one, right? You go through your annual testing, you send your physical product to them, they measure your label, they measure the font sizes, they redo testing for preservatives, they verify your ingredients that are listed on your label to the ingredients in your QQ. And if you're making any claims, they ask for all that, right? So there is a lot of back work that happens for brands that want to sell in retailers. So it's important to understand MoCRA is going to add to this list that you already take care of. And, I think it's important to also realize that this is to protect the brand as well, right? Having all these things in place, making sure that you are in this space of compliance while you're selling in the beauty retailer space protects you as well, because you have triple the exposure when you're in one of these beauty retailers, when you are on a shelf, right, and easily accessible to the consumer, to the public, right? This is where your increased chance or risk of something going wrong always happens, right? It's like Murphy's Law, right? The second you get into a big retailer, you're so excited, and then everything could go wrong after that. Next, we're going to go through an overview of large retailers' expectations of brands compliance. Retailer standards have shifted. I cannot tell you, I mean, many of you in cosmetics probably have just seen the change in retailers. And it's actually amazing. I think it's such a good thing, because it pushed industry to have certain standards. It pushed raw material suppliers to have certain standards that the FDA had not put into place until just recently with MoCRA. But more additionally, it really helps you define certain protocols, certain processes, and documentation collection. If you were unaware of certain things that you needed to have. While launching a cosmetic product, right? So most retailers require proper evaluation, robust testing, label reviews, quality manufacturing to ensure the products adhere to not only government compliance, but product integrity standards. US retailers require this documentation before launching a product in their store. And I won't mention the portals, but we all know those portals that we live in when we're trying to launch a product into a beauty retailer. It's document after document, MSDS and C of A and TDS and allergen reports, right? So you almost feel that the retailer in some ways are more stringent than FDI because FDA is just putting these pieces into place, right? Where retailers have established this for a few years now. Some retailers even have additional requirements. They do clean beauty lists, free of lists, sustainability and ESG programs, planet conscious, ethical standards. This planet packaging, planet positive things are just everywhere. Sustainability with packaging. Most retailers are requiring a certain percentage of PCR in your packaging. They're requiring to have some type of recyclable packaging as well. So it's really, really important to understand when you look at selling in a beauty retailer space, right? Like you're thinking FDA compliance, but it is so much larger than that. And this is the little sprinkling that I'm going to do about everything that I've experienced with beauty retailers is you want to be the most prepared as possible, especially if you want to go into a certain space in a certain retailer. Clean beauty, we see it all the time. Sephora Clean Beauty, I think, just started this wave of requirements and visibility into ingredients. And again, clean means something different to every single person. So don't quote me on what clean means versus what Sephora has, but they really did start a wave to try to at least make their products have certain ingredients to be classified as clean, right? And same of the free of, right? Free of sulfates, free of parabens. Walmart is also notorious for knowing this mindful beauty wave as well. And we will not see this stop. Like, I do not see this stopping anytime in the future. I think if anything, it's just going to keep growing. And I think it goes to show how industry really takes that into their own hands, right? So there's FDA compliance, and then there's retailer standards. And I think that those two together are a lot for a company to take on, a lot for a brand to understand. It's very important knowing this before going into retailer, what to expect, because it's a lot. It is a lot to take on. Retailer standards for good manufacturing practices. So you're probably all thinking, well, FDA hasn't even released GMP practices yet. How could they expect us to have GMP, already done at my facility or my contract manufacturer? So most retailers require products sold in stores to be manufactured under good manufacturing practices. FDA has released guidance to industry on GMPs for cosmetic products for industry. It will be obsolete when the new GMP rule comes out, but this is the guideline that was used for FDA GMP practices that closely follows the ISO 22716 standard, with provisions, of course, updated by FDA to be a little bit more robust in certain areas of testing and water treatment. So it is a variant of that original ISO 22716 GMP. But products must undergo recognized standards of quality for packaging, labeling, and storing of cosmetic products as well. One of the things is, yes, I made the product, it's perfect, it got manufactured perfect, C of A is perfect, specifications are perfect, and it's in a drum, in a warehouse somewhere, right? So what are the storing capabilities of that as well, right? So if a product's not meant to go above 30°C, right? And it's in a warehouse where it's not temperature controlled and can get up to 70°C, right? What is the integrity of that product, right? What is the storing of that product? And in terms of packaging and labeling, right, think of the same exact type of concept, right? If you have a hazard good, right, something with a high flammability rates, high VOCs, right? Is that packaged in an airtight container? Is the product integrity compromised by being in a different container than suggested or recommended? Is the actual barrel that the bulk is in labeled correctly, or the final good labeled correctly? We see this a lot, yeah, of issues with aerosol type of products, flammable products, nail polishes, right? This is that space we see, because regardless of the quality when it's made, what happens during when it's made to when it gets on a shelf is a completely different story. I've been there many times where I've made something, it's perfect, I go and let it go to the warehouse, pull the finish bulk to fill it, and something's wrong, right? So it's definitely a whole piece and step together. Most retailers already require third-party certification certificates, and also require annual audits. Now, ISO 22716 does their surveillance audit. So every year they have a surveillance audit with the certification every 3 years. But also, if you're not that ISO compliant audit, it's important to have some type of third party audit to make sure your factory or your third party manufacturer is adhering to quality standards throughout the year. Having been through hundreds of audits myself, domestic and international, I can tell you the week before an audit, we are the most buttoned up we could possibly be. So it's very important to always make sure to check in with your contract manufacturers, understand their audit schedule, understand how they're doing internal audits to adhere to quality standards, require that they issue CAPAs or CARs when issued or documented. This is a huge piece that I think we sometimes forget when we see that certificate, right? We see that ISO 22716 certificate or the GMP certificate. We're like, they're good to go. We're good to go, right? But we don't follow up with, do you have any CAPAs or CARs that we need to look at as well, right? Because that means there was an issue that had to be documented and then had to be resolved, right? How did they resolve that? Is it resolved? Is it still pending? Because that can really kind of go into whether or not you need to continue to manufacture your products there, or if you're going to foresee any issues manufacturing your products there. I have heard in industry, we just got back from the PCPC Science Symposium, that many people are getting FDA audit inspection letters, and I just want to let everyone know that this is a good thing, right? FDA is taking pulse on industry to see where everyone's at, right? Is everyone already doing GMP? Are they already ISO compliant? Because they want to release these rules so that they can align with small, medium, large brands, international standards. We don't want to be in a situation where FDA issues GMP rules that are completely different than what industry has already been following and doing, right? Because this will be a financial burden to try to get our factories up to the GMP standard that FDA will issue out. So I know probably a lot of you are panicking if you've received this inspection letter, but it is a good thing. This means that FDA is looking to see what industry is doing. They're looking to see how well industry is already prepared for GMPs. And I will say, I don't think anyone's always 100% ready for GMPs. There is still a lot of confusion, some things that always have to get checked. And it's important to understand those annual audits are there to confirm those standards, right? Are being held throughout the year. And I think it's more important, especially if you work with third-party manufacturers, to understand their audit schedule and make sure that you understand the quality management that they have in place. Just going to share, it was very public. Walmart released a letter. You can Google it and find it on the internet, but Walmart did expect all suppliers to provide proof of conformance with voluntary industry recognized standards of quality of GMPs. So that industry guidance for industry that FDA issued, Walmart expects their suppliers to adhere to that GMP for the manufacturing, packing, labeling, and storing of their cosmetic products. And they also said that they all had to be in good standing with FDA, right? So all those warning letters, there's a ton of warning letters that went out in spring. I mean, the whole page was flooded with warning letters for facilities. And, it's important to understand these warning letters are so that FDA can inform, right, industry, inform the public of what they found out of non-conformance. So check on your contract manufacturers, definitely ask for your GMPs. And if you are a contract manufacturer, trust me, I've spent my entire career in contract manufacturing. I think we have the hardest jobs out there, but definitely understand that we are those people responsible for the GMPs of multiple brands and multiple products. So we have the hardest job. We have the hardest piece to stay in conformance because there's so many products that are being manufactured daily, aggressively at some of them. So it's important to have a great system in place so that there are less mistakes, there are less deviations, there's less risk associated with making the products. And I say this because, it's very hard on a day-to-day basis to remember GMP is important, to remember GMP is how we make sure the quality of the product is solid. So, the only thing is get it out the door, get it shipped, get it on the shelf. But as you can see, retailers are asking for this proof as well. So what documentation should be in place to comply? So I want to just warn everyone, this is kind of everything, right? This is not specific to one retailer. This is the bits and pieces of multiple different retailers, even pieces of what I've discovered that you might have needed that I never knew you needed before. So take it as, this is not the golden grail list of what you need, but what you could have if you're working with certain brand retailer, some certain beauty retailers, so that brands can be prepared and understand the questions to ask. One of the things I feel brands always struggle with is, what do I ask? How do I ask it? What is it that I'm even looking for? And it's important when you're going through understanding this documentation and understanding what's needed. What do these things mean on a larger scale? So facility documentation, right? Very important. So facility manufacturing standards, their FDA cosmetic GMP certificate. So there are a ton of third-party, auditing certificates that can be held that they have the FDA GMP standards. They go through an entire checklist to make sure they adhere. Once new GMPs get issued out, we are going to see a whole new standard, I'm assuming. But for now, there are FDA GMP certificates that are provided by third-party auditors as well. An ISO 22716 certificate is also very beneficial, especially, required if you're selling outside of the United States, but then also makes you at least aware that there are GMP practices in place. ISO compliance is not easy. I have been through many ISO audits. I have helped build ISO facilities. It is difficult. So if they are ISO compliant, they have an ISO certificate, you have to at least have some confidence that there are systems in place. And then, of course, an FEI number, an FDA registration, and then a U.S. agent for foreign facilities as well, right? This is that new piece of MoCRA that retailers are going to make sure that their facilities have been registered. And again, you cannot register your product listing without registering your facility, but we have heard that this is possible to do, right, especially when it comes to contract manufacturers. So it's very, very important to understand where your contract manufacturer is in this process and what they have done with FDA registration. Supply chain assurance. So again, this is very, very important when we are going to be talking about adverse events. And I say this because when it comes to recalls, FDA has mandatory recall authority. And now, given that, right, having a recall plan in place is so important. And you need to verify the quality management system that a facility has, because if you need to recall a product due to an adverse event, public health concern, you need to know exactly what product has to get pulled, what product has to be recalled, how many units were shipped, sold, collected, everything. So this is to understand the documentation of the finished bulk codes, the batch lot numbers, day codes, and their internal tracking system. One of the biggest, I think faults we take as a brand, right, is that we believe that the quality management system that a contract manufacturer or facility has is easily understood by a brand. And that is not true. Day codes are issued on shifts, right? On a certain day, on a certain time. Batch lot numbers are completely different than a finished bulk code, right? So how are all three of these connected, right? Because one is on a batch card, one's on a whip, and one's on a lasered on a product. And then we're also learning that not everyone lasers their day codes on products either. So start thinking about asking your manufacturer or even your internal quality teams, how are we managing this, right? If there was a recall by FDA, how well would we do right off the bat? Can we take a day code and follow it all the way back to the batch that was made so that we can do an investigation, so that we're able to pull micro, pull safety, right? So that is the conversation you need to start having, because this will be something that is going to escalate in 2025. And I say this because once the adverse event contact goes on label, you are going to receive a ton of adverse events. There is no denying that. FDA was very clear about, the implications they have had with receiving adverse events, and that was just through their website. So expect that influx, right? And expect to have more adverse events come in once the labeling regulation goes into place. But before that happens, have this in place, right? Because the last thing you want to do is have your retailer know that you have no way to pull back your units. You don't know how many doors that product had went into. Lastly, the ethical audits. Again, not a requirement for every retailer. I will say these are requirements for certain franchises, if you know what I'm talking about. And it's important to understand when you're working with certain beauty retailers and you're under a certain franchise that these are requirements. And again, this is really to talk about the global type of ethical standards, and if there is any manufacturing or if there is any type of audit needed to evaluate social compliance, labor, health and safety, environment, or even business ethics. And this can go into play when you're dealing with beauty retailers and certain franchises, certain branding for your brand. So very important, and I wanted to throw that in there because we focus so much, right, on the product and the product integrity. I always want to make sure you guys understand there's like a scope outside of that as well when it comes to the facility, right? What is their health and safety, their labor, everything, their ethics of doing business as well. Product, right? Product is most important when it comes to what's going to go on the shelf, right? But what does that mean, right? So product listings, each product should have a product listing number provided by FDA. This means every shade should have a product listing number. We're starting to realize more and more after this July 1st date has passed that some brands have done the listings incorrectly, that they have just put 60 shades under one product listing number. And that becomes very confusing when you're working with beauty retailers who are going to start requesting these product listing numbers for each individual shade, right? So think of anyone who sells in EU, UK, right? These listing numbers are going to be able to identify these products, right? So if you take a product off the shelf or discontinue a shade, you're going to have to be able to do that, right? So organize a list to have available also upon request or to upload into the retailer portal. I'm not sure how many retailers have already put this in their portal. I heard a few, but definitely have an organized list because it's important important, that if they request this, that you have it available, not to go searching for this list, searching for these numbers. Request MSDSs, CFAs, and other documents to require that product listing number. I say that because eventually, right, especially if you're shipping from overseas, we've already heard of multiple, situations at customs where they're asking for product listing numbers and brands do not have this available, right? So we eventually will see some type of enforcement at customs. We don't know when, but have yourself prepared ahead of time. Make this a requirement to have this visible on certain pieces of documentation, right? Under, the name or something. And then any new products have 120 days to list with FDA. So let's not forget, as we move into holiday, as we move into, resets, that those products need to be listed. Even though they're on the shelf for a very short period of time, they are still in market and still require a listing number. Especially everyone doing kits and portals right now. I'm sure everyone's going crazy in those portals, but very important to understand that those need listing numbers as well. List of ingredients, either in a QQ or a QIL, very important to have. Finished formula, CFA, MSDS, TDS, and then all residual impurity statements where needed, and then any statements to verify compliance at a state level. Now, that is not a MoCRA requirement. Okay. I wanted to put this here and I wanted to make sure I said it out loud. It's not a MoCRA requirement. It is a beauty retailer requirement. So I want you guys to understand while you're collecting this information, to also collect this additional information as well. So you have your MoCRA documentation, and then you're going to have your beauty retailer information. Most portals, depending on the retailer, MSDS is always required. A QQ with percentages is always required. I've been seeing more often CFAs and TDSs. Impurity statements is going to be huge coming up in 2025. States are just a little out there with everything right now. So have your impurity statements, have your residual statements, have them ready to go. Any statements to verify compliance at a state level as well. So your 1,4-dioxanes, make sure you have a statement verifying that, or you have some type of testing to prove that. Washington with its new lead for color cosmetics, make sure you have testing to prove that. So start thinking about these things in a larger scale, especially when it comes to your product, of what you need to be prepared to have when you're going into the beauty retailer space. And again, you're probably thinking, oh my goodness, MoCRA, FDA, beauty retailers, and all of this information is a lot. And it is a lot, right? Because we go back to thinking again, the last thing they want is their name in a title that says recall. So protecting this information is important. Label. So again, the primary and secondary artwork are in compliance with FDA and state regulations. So again, there's going to be pieces of MoCRA that we will talk about on the next page, but I want to make sure everyone understands that the labels are going to go under a huge scrutiny moving forward because of the labeling updates that we've already seen with Professional and the one due at December. I do not have a date for fragrance allergens. I don't know if anyone's asked that question yet, but I do not have a date of that. We heard October, but we have not heard anything. But again, that is going to be another reason to make sure your labels are in compliance. In addition, you need to submit your label when you have a serious adverse event. So again, you're going to have a label exposed to FDA if you have a serious adverse event that you're not going to be able to change, right? It's going to be in their hands. They're going to see it and they're going to see any non-compliance. But more importantly, the beauty retailers take label compliance very seriously. You need to ship an actual physical sample of your product to them. You need to send artwork for them to measure on a live file, right? I will never forget, like I was sitting there and the woman took out a ruler and was measuring on the paper and measuring the box. And I was like, oh my goodness, I really hope that's the right font size. So make sure that they adhere to those font size and the sizing and everything for the label. State regulations, Walmart, huge on state regulations, right? Anything that needs to be labeled, California, Virginia, they are making sure you have that statement on there, and they're making sure that those statements are clearly defined. So there are a lot of things out there that we just are naturally not aware of because there's so many regulations per all the states. Make sure you have your mandatory labeling statements, your net quantities, ingredients, everything, right? Your principal display panel and informations contain the correct information. If there's any warning statements needed for specific products like pressurized containers, all over body sprays, sunless tanning. And then again, I cannot stress the font sizes because I think I have been dinged more times than I can count for font sizes because, marketing loves to just make it look the way that they want it to look, not realizing that shrinking or out of spec creates that little bit of out of compliance for FDA. So make sure you get that checked, especially before you go into a beauty retailer. I think this is the largest topic of conversation I've had in the last 2 months. And I will say that there is no one answer. And safety is going to be, I think, a highlight for the next few years in MoCRA. But more importantly, it is a highlight for beauty retailers. And I say this because they have always required a safety testing or some type of safety testing or some type of conformance with safety to sell in retail, right? The last thing a Sephora would ever want to do is to sell a product that was not tested for its safety or efficacy, right? So one thing with MoCRA is that they did not mandate an ingredient safety review. So when you're submitting your product listings, right, there isn't a review that happens for anyone who sells in Canada or sells in Europe, right? We know the safety review that happens when we submit our products. Canada, it could be 60 days before you hear back that your product is okay, right? And EU, UK, maybe even longer. And they require these TRAs, this toxicological review. So MoCRA is not like that. So there is no set list of testing. Retailers can require brands to provide certain safety substantiation testing. And, each cosmetic product has to keep that safety data. But what does that mean? What type of safety data? What am I supposed to be providing? And those who have kind of joined before have heard me say, look at your product, look at how it's used, look how it's going to be misused. And that is the best way to put your directions of use, to put any warnings, and to test it correctly. If you have a mascara, right, do your ocular testing, do your micro testing, do your contact wear testing, right? Things of that could potentially be an issue. But you can already use already available tox data that's on individual ingredients. You can use data on product formulations that are similar, and then you can do the traditional safety testing that we all know. HRIPTs, we could do ocular testing, micro, TRAs, and stability compatibility testing. Everyone forgets stability and compatibility is a part of the safety review as well. If a product is separating, right, and your water and your oil are going two different ways, right, chances are the pH of that product is not right. Same goes for any type of gel type of product, water type of product, right? The safety concern that can come from not having a robust, product that starts to fail, right? Half-lives of certain preservatives like the ethyl glycerins, right? I mean, those are the caproglycol. I don't think I'll ever use caproglycol ever again in my life, but right? So those we know degrade at faster rates in certain systems. So we have to be aware of the stability and compatibility, especially when it goes in pack, right? If your packaging is made of certain materials, right? Is there residual being picked up from that pack that can potentially cause a safety concern, right? I'm sure I'm saying all things that are saying, and everyone's had been there, done that, or I have never heard, have never been, and you're very lucky. But these are things that are really of your concern and to pay attention to. So, lastly, we're going to talk about how to handle the new label, right? And I think there's tons of questions out there. We were so lucky at PCPC to have FDA there. Dr. Katz did a phenomenal job educating everyone in the room. I think there was only standing room left by the time that she was speaking. So she gave us some really great information about adverse events. So I'm going to share them with you guys if you had not. We're not at PCPC, but she did let us know, about the adverse event electronic portal is coming right now. Everything is sent through an email, FDA email. Everything is very electronic, right? And we're using a MedWatch form that is very confusing. Tons of links about how to fill out a MedWatch form. But she did give us the insight that a portal is coming for cosmetics. And I think that is the biggest takeaway from here. What I want to remind everyone is that December 29th is that date. So you should have something on your labels of anything going in for holiday. We're having lots of discussions with people right now who are like, well, when does this happen? Are they going to extend it? And it's no, they are not extending this. We had 2 years to put stuff on, put the contact information on label. We should be prepared as industry. So we have a lot of people asking a ton of questions. I'm going to give you as much information as I know and as much guidance as we can give until we get further from FDA how to properly do this. But it is required on both primary and secondary pack. This is because if you have a carton, you throw the carton away and you're left with the primary, your adverse event contact cannot be on the secondary pack. FDA has said how the responsible persons are allowed to display. So it should be either a physical address, so domestic US street address, a phone number, domestic US phone number, or electronic address as a website or QR code. It is either or. So you don't need to have all three. You can have a electronic address versus physical versus phone. What's most important is please select something that you're going to be able to track adverse events. You do not want to pick a phone number that goes to some Google message voicemail that no one ever checks, or a physical address that no one is there, right? This is not how this should be handled. You should be picking something that somebody is checking every single day. When I say that consumers are aware that this is coming, and they feel that there has not been a space for them to communicate when something happens with a cosmetic product when they use it. And this is going to really turn brands into a different type of quality standard and adherence to FDA standards for adverse events. So very, very important. One thing to also mention, electronic address, the website or QR code should not lead to a saleable site. There should not be 1,000 pop-ups of here's on sale, here's new launch. We have been working with a ton of companies to help them alleviate maybe a website that's already on their pack and how we can integrate a new way of them leading towards a place to report adverse events. So if you're having that confusion right now, please reach out. We can help kind of get you through this first initial piece while you're updating your labels. FDA has not provided language or verbiage that should be used. So, if you have something like a QR code that says for adverse events, report here. But our label team has come up with some fantastic ways to say the right thing in the right space and not overpower the label with this type of language. We do highly encourage it. We don't want the consumer looking around to see where they have to report an adverse event. As you've heard me say 1,000 times before, you want to be the first one to know when something's going wrong with your product. You do not want a retailer to be the person to tell you something's going wrong, right? So giving that streamlined communication to the consumer where they can report will help you alleviate that. I always tell a story of we were selling a product in a retailer and we thought we were doing amazing. It was flying off the shelf and the retailer called and was like, we've received hundreds of calls of the product, and I was in awe that we've received zero. We thought we were doing so well. So always be the first person to want to know what's going on with your product. Retailers have also requested brands to give them their adverse event contact information, right? The retailers don't want this responsibility. They don't want to take this on. Again, this is very, very new. So most companies do not have something in place. This is not going to go through your consumer complaint department. This is going to go through a quality regulatory piece. You're going to have to get involved with your legal, your manufacturing sites, your testing sites, right? So there's multiple people that have to get involved in this. When we were talking with Dr. Katz last week, and the importance of this, right? We've seen the adverse events that have happened in the cosmetic space over the past few years, and it's been a huge uptick because we are getting more innovative. We are using more products every day. We are experimenting with where products should go that are not supposed to go. So living in this new beauty industry of pushing boundaries, we are going to see adverse events, and FDA is really aware of what has already occurred, and more recently what has been larger issues that they're addressing. So they want this information. They want to understand what's going on in industry, especially with certain products, because they want to be able to catch it, right, and protect the public health. More importantly, I think that the record keeping was the true piece that came out, right? And we always talk about the responsible person having records for 6 years, right? Your manufacturer has to hold those records as well. If you are using a contract manufacturer, they need to know there was an adverse event that happened with your product, right? So streamlining that communication, so that they have those records as well and can show the pieces of the investigation, the assessment, the review that they provided. So those CAPAs, those CARs that we talked about, right? Non-conformance, all of those pieces will have to be on the contract manufacturer or manufacturing side as well. So meaning FDA shows up at the manufacturer, they have them. FDA shows up at the responsible person, they have them, and they have to make sure they align. And I cannot stress that enough, right? Because that was a direct question that came up, and that was asked, during the session. So understanding that communication is really, really important. And again, I'm going to put this here so you guys can see it. Brands can detect issues and patterns and act quickly to alert retailers. Retailers love when you are the one to say, like, we might have an issue. We need to do something about this. Can you please check your product? How many units do you have, right? You cannot do that if you don't have a proper record keeping system and you don't have a proper intake system. But good news is you can normalize rates as well. You can do predictable events with the use of a specific product. You're able to determine acceptable ranges and actionable variations, right? So if someone keeps turning, sensitive skin keeps turning, red with the use of a certain product, you can go and do a sensitive skin study, right? And determine, right? If you have sensitive skin, put this warning on there, like do not use at the same dose at the same frequency. These are things to find while you're in this post-market world. And I will always say post-market surveillance is the best safety data information you could possibly have. It really enhances your ability to see your product in a huge demographic. We do the safety testing, right, on 50 people, 200 people, right? That is a certain demographic, a certain skin type, the claims we want to make, right? So what is it when it really hits the world, right? When it hits the market, when it hits the industry in the right way. And you cannot get better data than that. Selling 3 million units, no adverse events. I mean, I would say that's pretty safe. You also can provide retailers with quarterly reports, right? So if you're tracking all your adverse events and you're tracking the sales of your products, right, you can actually share with them. We've sold 3 million units and we have not had one adverse event, right? And that also gives you an idea of how well you can show your retailers that you are taking control of the quality and the product integrity of your products. Add reassurance for the intake system so that if there is a problem that you're able to recall batches quickly. We have all been there. I mean, we do not live in a perfect world of manufacturing and it happens, right? But showing you the proper intake system will show that you're able to pull back those batches, right? And also working with the facility on their QMS system and how you can have a date code go to a batch code, go to a bulk code, right? Those all are going to be intertwined into this. A brand's quality management system for adverse events prevents retailers from having to handle the consumer reports. And I can't stress this enough. Be the first person to know that there's a problem. If a retailer is getting hundreds of calls because there's a problem with your product, chances are that product will just be pulled from the shelf. There's no questions asked. There's no, we don't care. There is get it off the shelf, right? So understanding the problem and being able to be proactive instead of reactive in this situation will definitely help you as a brand move forward. I know we're going to be tight on time. I know I said I left time for questions, but we're going to go through this a little quickly because many of you have probably already seen, but FDA has new authority. They can inspect facilities and request certain access. They can put certain products, manufacturers, countries, companies on import alert. They can suspend a facility. Very important to understand what kind of new world we're going to be going into, especially with new GMPs. They have a mandatory recall authority now that they can recall the product, and then they can and have always been able to issue warning letters that we have seen, and then import detentions as well, right? So anything that appears to violate the FD&C Act, FDA is going to be able to stop at customs. Now, as we move into understanding the mandatory recall, this is heavily related to a cosmetic product being adulterated or misbranded. This is also with the use or exposure of the cosmetic product leading to a public health concern or serious health adverse event. So the responsible person should understand what FDA is going to be looking at when they determine they need to do a recall. And this is why your intake system for adverse events is so important, right? Your review, your assessment, your review, investigation, and assessment of why you did not recall a product. And there's different types of classes that are currently under the 21 CFR, but understand as a brand how you are going to handle those reviews, how you're going to handle the investigations. Because if it comes that FDA asks you for records and it shows that you did not recall a product that was having an adverse event out in industry, right? What are your reasonings behind that? What were your quality checks behind that? Inspections and record access, like I just mentioned before, both the responsible person and the facility are going to be inspected for these records. And it's very important to understand that this is when a cosmetic product or ingredient is likely to be adulterated such that the use or exposure to the product presents a threat or serious health adverse event. And FDA will have access to all adverse event records and be able to take this required information. One thing to note here is that once we see these fragrance allergens and flavor allergens coming out, we're going to start to see a lot of these fragrance houses having to give information that they did not want to give in the past. I talked to a ton of fragrance houses last week, trying to understand what type of testing they were doing. Luckily, a lot of them are proactive. They're doing all the testing for the new fragrance allergens that were issued by EU, UK, and now Canada. So they're going to be kind of ahead of the curve with this. Given if FDA provides a list that's similar to Health Canada, FDA, or Health Canada, EU, UK. But we shall see. I think we have 2 weeks left in the month, so it'll be very interesting to see what comes out. So questions, as promised. Very quickly though, don't forget registrar. We have a ton of services that we offer for cosmetic products. We help with all your product listings. We help get them done quickly and accurate. We are offering free MoCRA gap assessments as well to make sure that you have handled your product listings correctly, adverse events intake systems correctly as well. Our software, I'm sure many of you have seen, and it is just phenomenal. We were able to display it to PCPC last week, and we have had phenomenal feedback, especially if no one in the company has a certain system in place, or you don't have a quality person on staff. This is a great way to start to build your quality management systems, especially when it comes to adverse events. And our online training, I'm so excited to share that we are just constantly expanding our coursework, GMPs and quality assurance, good laboratory practices, really, really heavy on the quality pieces. And I say this because this is going to come into huge play when it comes to, beauty retailers and understanding the quality standards that they're going to adhere to. There will be a survey at the end of this wonderful webinar, and I hope you guys enjoyed it. I know it's a little bit different than we typically do, but I hope you guys did learn something, especially about beauty retailers and expectations. But please take the survey because this helps us understand if this is content you like, you want to hear more of. We even have a suggestion box for anyone who wants to hear some more things. We do have some exciting webinars coming up in the next few months, but we want to really get, at the end of the year from all of you, all of our listeners, what do you want to hear? What's great? And of course, if you want to learn more, most important is if you want to learn more and how we can help. And I think it's really important, that we get this feedback from you guys. So I appreciate it ahead of time. It takes really 2 seconds to fill out. So let's get to some questions. Yes, I see a lot of questions. This recording will be sent out at the end, so you'll get an email. Very, very important to know that. So one of the questions I see here is, do we need to report all adverse events or only serious adverse events? So technically, FDA is only requesting that you report serious adverse events, but I'm going to say this as a recommendation. If you are receiving a ton of adverse events for a specific product, this is not something to just file away in archive, right? This is something that you need to look into and be concerned. One serious adverse event versus 20 non-serious adverse events, you have a concern, right? So with that product that has a 20 non-serious adverse events, in that case, I would highly recommend reporting, because that means there's an issue, right? And you're receiving 20 non-serious adverse events, and you want FDA to know that you're handling it and that you're aware of it. The worst thing that you could do is have this type of situation where you're experiencing non-serious adverse events with the product and not taking care of it and just archiving it and filing it away. And I say that because we are just very busy people in industry, and we're very busy to stop and not do something that's not required, but it will save you a lot on the end, because FDA does not need to have a serious adverse event only to recall a product. They can consider something a public health concern as well. And a public health concern would be a product causing hundreds and hundreds and hundreds of non-serious adverse events. So definitely a company consideration, but definitely something I would recommend, just so that you can feel a bit more comfortable with how your visibility is into FDA. If they do ever come and inspect, that you could say, yes, this was non-serious, but we reported it because we received so many. And again, I see a ton of how should industry be handling non-serious adverse events. I'm sure if Dr. Katz is here, she would say send everything to them so they could know. But that, and I would lean on the air of, yes, that's probably the best way for FDA to get as much information as possible. It's also very, educational for the industry to understand too where there's potential issues. Walking into this new MoCRA world, the beauty retailer world, right? More importantly, is understanding that certain products do have the tendency to have a higher risk of having an event happen when used. So it's not something to shy away from. It's not something to hide. It's not something to feel bad about as a brand. It just happens because of the nature of cosmetic products. And, I say this all the time, is like, cosmetics are personal, they're sensitive, right? They're going on our bodies to do certain things, your hair, your eyelashes, your makeup, right? So it is a very personal thing. So it's important to understand that this is personal for everyone, the brand and the people using them. So the more information we know about certain products and their reaction to certain people when they use them, the more information we have as an industry to kind of help the next wave of people come in and educate them, right? This is a lot of what the EU and the UK does with their toxicological reviews, dermal absorptions, and all of their margins of safety, right? Gathering all this information helps them understand how products are going to work on an actual person, right? And on multiple demographics. Um, I have a question here. Is it mandatory to put all contact information on the end product below 20 milliliters grams? So, yeah, so every product that is in market needs to have adverse event contact information. And it's very important that you understand, regardless of the size, regardless of where it's going, it in market, online, or in store, it needs to have that contact information. The huge question I get is, well, my package is really small, and this is why we should be preparing as industry how to handle that. We are very lucky to have URLs and QR codes. No other industry has this, so utilize that. We have worked with many customers putting QR codes on their package. Some have even colored it into their package because there's already so much information. Very easy to put on the bottom of a lipstick label, on an eyeliner. So very, very important that it's on every single cosmetic product. I see one question. Any feedback to share with us about FDA control on product from July 1st? Yeah, so we have heard at Customs they're asking for product listing numbers. We've had a lot of feedback that it is from, international foreign facility, foreign brands bringing in, and that is where they're asking for these numbers. Like I mentioned, the enforcement, I think, will be really into high gear, high effect once we understand FDA's system at Customs. But we have already heard a ton of enforcement. That being said, I'm going to say it again, beauty retailers are already requiring this information. So they are already saying, have your product listing number before you get in our shelves, right? So there is more to be, heard, I think. More to be said about what the enforcement is going to look like. FDA also is extremely aware that this is a huge shift for industry. So I think they are giving people a little bit of time to get compliant, especially those working with foreign facilities. And foreign facilities seem to be struggling a little bit with registrations and what to do. So just keep in mind, if you have any struggles with your foreign facilities, bring them to us. We'll be able to help them. We have offices around the world, and I think that is the biggest help, is that we have people who speak multiple languages and can communicate exactly what has to be done for those records. Let's see, we'll take two more because we're just at time. We do help with a ton of consulting. I see a ton of questions about safety testing. What do we need to have? What do we not need to have? We help with all that through our consulting. I see a ton of questions about label. We have an amazing label review department. So highly, highly encourage to come and get your label check report or a free assessment of your labels, so that you can really see if there are any issues. The last you want is to be in a situation where you have to provide a label to FDA and it's non-compliant. I would also want to just kind of close out this webinar to say as well, again, this is very much as a mix of beauty retailer and MoCRA. If any of it was confusing, which parts were MoCRA, which were beauty retailers, you can just reach out as well. I try to give you guys as much of my industry knowledge and industry experience as possible. I think it's really important that, we tell you the experience, right? The regulation is so important, but what is the experience when having to do all of those regulations in real life? So again, please reach out if you have any questions. I also would highly encourage the survey one more time. I want to hear your feedback, because this is the first time we're doing something like this, a little out of the box, and I really hope you guys enjoyed it. I really hope that the topic, I would want to expand on this even further, right? Deep dive into real beauty retailers and portals, and what does it mean, and all of that. So definitely give us your feedback. I welcome everyone to join us again next month. We'll have something really trending and hot topic again. And any questions, again, reach out. Thank you, everyone.